Good afternoon, everyone. I'm Rebecca Zerman with Arkansas Advocates for Children and Families. We coordinate the Arkansas Kids Count Coalition, a membership group of individuals and organizations around the state dedicated to improving the lives of kids and families and raising awareness about policy issues and how to advocate. This is our first ever virtual Kids Count Week at the Capitol, and we're so excited to have you today. 2020 was a difficult year for kids and families, but child advocates like you rose to the occasion, making sure families were fed, helping people stay in their homes, and providing people mental health care. But we're all here today because now it's 2021, and we know that the Arkansas General Assembly session is underway. It's critical for us to make sure that we show up at the Capitol and ensure that the laws that are passed reflect the interests of children. This year and recommendations on how to advocate. We'll also have opportunities where you can network with your peers. In just a moment, we'll hear from advocates around the state who will share their inspiring stories. But first, I wanted to talk about a few housekeeping items. Household items may come into play because a lot of us are working from home. But we do have a lot of social media activities this week. You all should have received a welcome email this morning. If you didn't, that's okay. I'll put the information in the chat. But we will have opportunities where you can post online using hashtag ARKidsCount. We have social media graphics that you can use. And tomorrow, Senator Greg Leding will be posting on Facebook, Twitter, and Instagram about the day in the life of a legislator. He'll be taking your questions about the legislative process, and he'll be having a Facebook Live event at 4 p.m. tomorrow that you can participate in. We also hope that you'll attend legislative committee meetings during the week. You can Google Arkansas Legislature and go on their homepage. At the bottom of the homepage, you'll see a list of committee meetings for the week. You can see agendas, and you can also watch meetings live and watch recordings of past meetings. But I want to go ahead and get things started with Regina Taylor from the Arkansas Food Bank.
Thank you, Rebecca. And thank you to the Arkansas Advocates for Children and Families and the Kids Count Coalition for this opportunity. So what is the difference between food insecurity and hunger? We get that a lot at the Arkansas Food Bank. The two concepts are closely related, but are distinct. Hunger refers to a personal, physical sensation of discomfort, while food insecurity refers to the lack of available financial resources for nutritionally adequate food at the household level. As Rebecca indicated, 2020 was a difficult year for our nation as well as our state. For our nation, prior to the coronavirus, some 35.2 million Americans were listed as food insecure, with 10.7 of those being children. Now, with the coronavirus, some 50 million Americans are at risk of being food insecure, with 17 million of those being children. Rates of food insecurity are often higher than the national average among the following households: households with children who are under 6, and households of children who are led by a single parent. For Arkansas, our food insecurity rate is at 22%. At the Arkansas Food Bank, we saw a 37% increase from 2019 to 2020 in the amount of pounds we distributed across our 33 county service area. We know that this had to do with the coronavirus as in its impact, with workers being laid off, schools being closed, and many seniors being homebound. Now, more than ever, Arkansans are in need. For children, however, it breaks my heart to share this stat. For the projected amount for 2020 due to the coronavirus, some 29% of Arkansas children are at risk of being food insecure. That's 1 in 3. We know that our work is ongoing and it never ends when you're working in a field such as this. But there are so many things that we can do to help address that need in our state. We know that when children receive food, they need to grow and thrive. They perform better in school. They have improved emotional and physical development. And ultimately, they focus more on themselves and their community and not their stomachs. Advocates, we are here because we support efforts to help ensure that our children have a brighter future and tomorrow. We do that through several programs, like the Supplemental Nutrition Assistance Program, or SNAP. It helps families address hunger and secure economic situations in a brighter tomorrow. The Emergency Food Assistance Program, or TFAP, it helps provide families of low income with children or even seniors to help provide additional food resources. Or the pandemic EBT, the electronic benefit transfer, that helps parents whose children may be recipients of free or reduced lunch through the coronavirus, but because of school, maybe it's stopped for whether they have to be in isolation or quarantine, they can still receive those EBT benefits to help feed their children. Or even the temporary assistance for needy families, the TANF program. This year we were able to work on building a school pantry program that benefits those children who may be, whose parents may be a part of TANF. Again, food insecurity is a huge issue in our state. And I'm glad to be a part of the Kids Count Coalition to share more insight on this issue and ways that we can help our fellow Arkansans live a better and brighter future. Thanks, Rebecca.
Thank you, Regina. Up next, Melissa Leylon with Arkansas Coalition for Marshallese.
Good morning, everyone. I want to also thank you. Thanks our friends at Arkansas Advocate for Children and Families for offering me this opportunity to really just share my story. I don't have a lot of fancy data sets and numbers for you, but I will be sharing our really stories that are very personal to our communities. And as we have mentioned, and Rebecca mentioned earlier, this COVID-19 has impacted a lot of our families, particularly in the immigrant families. In this case, I'm going to be sharing about what really happened when COVID-19 took over and took place. So prior to the COVID, we know that 1 out of every 5 Marshallese that live in the United States were uninsured. And that's why it was very, very important for our organization to partner up with Arkansas Advocates back in 2018 to ensure that the Our Kids program was extended to the Marshallese children. So we were very successful in that. And that's due to the heart and the nature of the work that we do and the partnership that we created together. And really, another good news that occurred took place about a month ago when the COVID relief legislation was passed. Marshallese adults have now been extended the Medicaid program. So that's going to be a really success story here in Arkansas. As we all know, the COVID-19 really hit this community pretty harshly, and over 50% of the death cases in Northwest Arkansas, Marshallese were accounted for those. So, you know, it just the work that we do and you know, to me, the passion that we have for this community and for the state of Arkansas. So I will share some numbers, and I know that I have some folks from University of Arkansas who are probably listening in, and we have launched a few programs around, you know, growth or trying to develop the Marshallese community. One of them was the individual development account, which basically help families to develop assets to be able, so we can pull them out of poverty living. So I wanted to share something. When we did our study, we found that 71% of those children, they will live in poverty. So I just wanted to end with that and let you know that, you know, the work that we're doing is, I feel like it doesn't need to stop. Marshallese children at this point, and Marshallese citizens cannot and do not have access to the SNAP program. And as we had mentioned, and we heard earlier, that food insecurity is a really huge matter to be paid attention to here in Arkansas. Thank you so much for the opportunity.
Thank you, Melissa. Up next, Dr. Brooke Shield-Laurent, who is co-chair of the Arkansas COVID-19 Health Equity Response Team.
Hey, thanks, Rebecca. I'd say thank you to you and the leadership team for the Arkansas Advocate for Children and Families, and on behalf of the COVID-19 Health Equity Response Team, for the opportunity also to work with Ms. Loretta Alexander, who invited me. So I thank you so much for that. So just a brief introduction. I'm a family medicine physician. I'm a chair for the Department of Clinical Medicine at the Department of NYIT, College of Osteopathic Medicine at Arkansas State University, and also the executive director for the Delta Population Health Institute. I had the very good pleasure of serving with the co-chair, Dr. Gloria Richardis. She's a professor of reproductive endocrinology and infertility at the Department of Obstetrics and Gynecology at UAMS, and also the executive director for the Division of Diversity, Equity, and Inclusion. Excuse me. So the COVID-19 Health Equity Task Force, which represents a diverse group of health people in the health agencies, advocacy, and other community-based organizations, was commissioned by Senator Ingram to provide recommendations to ensure that there's a robust equity framework that was applied throughout all statewide COVID-19 responses. And I know that I'm talking to the choir, people who are in the trenches and working, so I'm not going to go into the stats. They're very familiar, but they're also dismal. Black, Indigenous, Latinx, people of color in Arkansas have a higher disproportionate rate of infection and mortality to COVID-19. But for many of us, this unfortunate reality is actually not a surprise, because we see these inequities in most of the social determinants of health, transportation, education, food insecurity, housing, social environment, cohesion of communities. All these things are strongly associated with health outcomes. There was a recent peer-reviewed journal called The Proceedings of the National Academy of Sciences in the United States of America. And it recently published an article this month which stated that the progress that we have been making as a nation to decrease the gap between racial disparities is actually going backwards because of the pandemic. So calculations have been made that COVID-19 will reduce US life expectancy in 2020 by 1.13 years. And the estimated reductions for Black and Latinx populations are 3 to 4 times that for whites. So this is recent data that just came up in January to say that consequently, COVID-19 is expected to reverse over 10 years of the progress we have made to try to close the Black-white gap in life expectancy. And that's significant, and reduce previous Latinx mortality advantage by over 70%. So we have a lot of work to do. I know that we all know this, but we have some calculations that are standing before us that we have to consider. And I'll share that article on the chat if you want to take a look at that for your resources. As a healthcare professional, I've come to know, like many of yourselves, that life expectancy begins with the conditions where we live, learn, grow, work, and play, and these calculations are staggering. So what the Health Equity COVID-19 Task Force has made were recommendations to aid policymakers and key stakeholders in decision-making regarding our efforts to navigate the pandemic, but not only just toward the pandemic, but also to address recovery issues. And these recommendations have been posted on the Arkansas Department of Health webpage, which we can give you resource to as well. We were guided by the Robert Wood Johnson Foundation brief on health equity for state and local leaders responding to reopening and recovery from COVID-19. We used geospatial mapping tools to identify areas that were most vulnerable to the pandemic, determined by the poor indices of social determinants of health, In our deliberations, we found that the decisions that were being made on a state level was in dire need of comprehensive data assessments that goes beyond health outcomes, but include determinants of health. And we advise that there be enhanced coordination among public health agencies, community-based organization, supporting local health entities, and strategic campaigning specific to the needs of the populations that we're speaking about today. And it's no longer an option that policymakers, along with public and private organizations, truly must work collectively to meet the needs that we're faced right now. So very quickly, what I'm going to do is talk about the high points of our recommendations. One, we targeted support for healthcare providers, independent clinics, and primary care offices. There were reports from the Primary Care Collaborative that said about 35% of primary care practices may close post-COVID-19. So we already were at a baseline, had significant issues with addressing chronic illnesses and access to healthcare, and with the health entities, which essentially are businesses that were affected by the pandemic, they're expected to have more closures. And what does that mean? More morbidity, more mortality amongst the populations that we're speaking of, including ourselves that we're talking about right now. So there's a lack of chronic disease management. We also made recommendations to support statewide coordinations with community lay health workers, health champions, and to make sure that the community health workers and lay health workers were integrated in targeting, campaigning, educating, screening, and wraparound services for social support. We also recommended some monetary support for mobile health units to go into communities for testing, for education, for preventive screening as well. And we asked that they expand public health service campaigns to become culturally and linguistically appropriate across all communities. So these are some of the things that we had made recommendations for. We asked that they continue to support community-based organizations that were already supporting our communities, and they needed funding too. And the needs were significant. Faith-based organizations needed some support as well, because they were helping with some of they were assets in the community that were supporting members of our community that were using their services. So before I go, there are three things that I want that we walked away with when we did our recommendations through the Equity Task Force. Number one, the pandemic showed us that there is no us versus them. This situation that we are shows us that we are intricately connected with one another, and all of us have a degree of vulnerability, some more than others, but all of us have a degree of vulnerability. And we are seeing that when the vulnerability increases, it affects us as a whole. From adult care providers, children, family members, school teachers, delivery service people, grocery store clerks, factory workers, first responders, and the like. So I think we're very familiar with that, but I just wanted to state that we can no longer afford to work in silos. As a matter of fact, if we don't strengthen our collective efforts, it will subvert our own efforts within our own industries in the space that we're focusing on. So we do have to take an interdisciplinary approach, invite non-traditional partners in our thought meetings. And I know that I'm preaching to the choir, but let it be said, because it's not an easy task. We have a lot of work to do. Another second thing that was very interesting to us is that we must invest in data and technology that can bring insights to the problem we are facing to provide guidance for better solutions. We have to advocate for comprehensive data collection and the requirement for disaggregated data, because people groups who are not counted remain invisible, but the outcomes of inequity of our communities remain tangibly painful without fully understanding why. So we can't fully understand the depth of the issues we are facing and if our interventions are even working without the proper data collection. I'll also say that we also have to challenge traditional measures of success and show the value of community that is inclusive and cohesive. So we have to bring data technology experts that can help capture lived experiences in a very tangible way, in a way that's not explicit through traditional research measures. So we need to invest in technological platforms and immediately track factors that can identify markers that lead to disastrous outcomes before they happen. And the last thing we walked away with is that connectivity has widened the divide significantly. The pandemic era has shifted a world that is pushing us into the virtual space, and we're not going back, even after the pandemic settles. Education, health, information, obtaining commodities will continue to be out of reach to those who have not, who are not connected, have connectivity or broadband. So without advocacy for disconnected areas, strategic generational planning, investments in disconnected areas, our communities will fall further behind and we will lose progress in the work that we've done to date. So I will just say this, in spite of all this, I am audaciously saying that I'm hopeful. I'm confident that the assets in this community and this network makes the turn of this tide within our reach. My experience as a physician with children and pediatric organizations is that you get conditions about where we live, learn, work, play, and pray at the heart of what you do for advocating for the well-being of children. You understand the vital role of interdisciplinary collaborations, and innovation tend to come out of these organizations because you know how to wield your collective assets and your voices so well. So with that, I add to the charge of what we are called today by my fellow peers. May I just bring to your remembrance that we are not alone. We have to draw strength from one another and a shared vision of wholeness. So thank you so much for having us, and I'm excited for what's ahead. Thank you.
Thank you, Dr. Laurent. Up next is Dr. Nikki Edge, educational psychologist and board member of Arkansas Advocates for Children and Families.
Thanks, Rebecca, and thank you to the whole Advocates team for finding creative ways to safely bring us together to advocate in new ways this year virtually. I am going to use my 5 minutes to share 5 key facts about adverse childhood experiences, or ACEs for short. ACEs is a term for describing potentially traumatic events that can occur in childhood. So fact number 1 is that these are experiences that are extremely stressful for children. Things like witnessing domestic violence, physical, emotional, or sexual abuse, growing up in a family where there is substance abuse concerns, or parental mental illness. Fact number 2 is that ACEs are disturbingly common, and kids in Arkansas experience more ACEs than children nationally. So our best estimates suggest that 1 in 7 children experience some form of abuse or neglect in any given year. So if you think about a classroom of 20 children, odds are there are 3 children who are actively experiencing abuse or neglect. About 12% of Arkansas children are living with household drug addiction. And our children are twice as likely to have a parent in jail or a parent who has died compared to children nationally. Fact number 3 is that ACEs put children at risk for a range of problematic outcomes. And this is especially true when these experiences begin to pile up in the life of a child. 1, 2, 3, 4, many of these experiences. We believe that one of the reasons ACEs have such a wide-ranging impact on child health and development is because of how experiences of serious stress can alter the way our body's natural stress response system functions. And this results in stress chemicals like cortisol and adrenaline repeatedly flooding the brain and bodies of children in ways that are not healthy for our brain, for our organ systems, for our immune systems. And this puts children at risk for a range of problems. It can impact brain development, leaving the part of the brain that's responsible for thinking, focusing, planning, and solving problems underdeveloped, and the part of the brain associated with fear and anxiety overdeveloped. This can impact learning and behavior, leading to problems in school and later in the workplace. And we know it leads to mental health problems like depression, anxiety, post-traumatic stress disorder, but we're learning more and more that because it impacts our immune and inflammatory systems, this increases risks for physical illness lifelong, including very serious illnesses like cancer, lung disease, and heart disease. The human and economic toll is incredible. But fact number 4 is going to take us into better territory, better news. Not all children who experience ACEs, even a very high number of ACEs, have long-term negative effects. This is not destiny. We know that good experiences help counterbalance bad experiences. So ACEs create risk for poor outcomes, and good experiences can reduce that risk. We reduce risk when we provide children with safe environments, engaging learning opportunities, and most important, ensuring every child has a supportive relationship with a caring adult, because the research is very clear that children who are resilient or bounce back after a trauma tend to have one thing in common, and that is they have a stable relationship with a caring and supportive adult, a parent, a teacher, a grandma, a coach, a Sunday school teacher. a person who helps them feel cared for and safe. And that sense of safety calms their overactive stress response system. So fact number 5 is that this science tells us we have solid policy solutions to reduce the impact of ACEs on our state. So I want to talk about 2 kind of hows we do that. The first how is that we have effective ways to stop children from being exposed to so many of these adverse events. For example, we have wonderful research from right here in Arkansas that shows us that when parents can access substance abuse treatment when they need it, children's lives are transformed. When we're able to help a family out of domestic violence, the child's ACEs are reduced. They won't grow up witnessing that. We know how to prevent abuse and neglect through proven effective programs like parenting classes and home visiting programs. So from a policy perspective, our job is to make sure that these kinds of supports are adequately funded and widely available in our state. And then second, and we know how to build resilience in children who've experienced ACEs. So one example is that when young children can access high quality childcare, they have access to a safe and nurturing relationship and a place that's safe and secure, and their stress response system can calm down. I see this every day in my work. We see kids whose lives are transformed in a matter of months with the nurturing care of an early educator. And relatedly, we're learning a lot now about ways to transform our school systems so that they're truly trauma informed, meaning that all members of the school community understand how trauma is impacting students, families, and even staff. And they understand their role in helping one another and building resilience in kids. And of course, we have effective mental health treatments when kids need more, when families need more. And again, as a community, we just have to make sure these supports are available when they're needed. So this session, I'm going to be watching for opportunities, and I hope you'll be watching for opportunities to support policies that focus on preventing ACEs and policies that build supports to help children overcome ACEs when they've had those very difficult experiences. And with that, I'll throw it back to Rebecca.
Thanks, Nikki. Up next, Cherise Smith with Partners for Inclusive Communities.
Hello. So I was asked to speak from an advocate standpoint because I do have a disability, and about children. Now we know that in the South, disability is at its highest rate in the South. People in the South are older, there are less services and resources. So in the South, disability happens at a higher rate. And the rates are not even including the people that are in institutions and in foster homes that are not counted. So one of the laws that was really, really powerful for people with disabilities was a law called Rose's Law. Rose's Law was created named after a little girl who had Down syndrome, who didn't like the word retarded. And so President Obama signed a law in 2010 to get rid of that word out of the educational and healthcare codes. And it started in Maryland and then it went nationwide because they found that the way you talk to people is basically, it impacts on how you view them. So we had a campaign called Spread the Word to End the Word. Here in Arkansas specifically, through an organization called Arkansas People First. And the reason why we felt it was so important to speak to legislators is because nobody knows our story better than us. I'm sorry, I have a dog. Nobody knows our story better than us. Nobody can tell our stories better than us. Nobody has the lived experiences of a person with a disability. So while we love our allies, we need our allies, nobody can go in and talk to legislators and make the greatest impact than we can. So we go to the Capitol, we partner with people and to try to create changes in our policies, in our laws, in our programs, and in the way we speak to one another. Now, coronavirus has made things very difficult because you know, people with disabilities are already disconnected in our community because of access to services and goods and services. And now with the coronavirus, everything is even more exacerbated because we can't get, for instance, we've had problems with testing. So in getting to rapid testing organizations to get us tested and getting access to the internet, Partners has a iPad program that we're working on to hopefully fill that gap in services so that people with disabilities and elderly people can be able to at least fight off the isolation that has been brought on by the coronavirus. And this was expressed because of people with disabilities have come in and said, we need this for us to feel less isolated. We need connection to our doctors and telehealth and our family and friends, because, you know, people often think that social isolation is not a big deal, but it is a huge deal in our mental health and how we take care of ourselves. And so when we had advocates such as myself who said, these are the things I know from personal experience that people with disabilities need. And also, while allies are great, service people are great, people with disabilities are often going to talk to other people with disabilities. It is our job to get those messages across. You know, we need the ability for advocates to testify remotely because they can't get transportation because of healthcare concerns and them being at a higher risk for the coronavirus. They don't want to be in public. I do not go in public unless it's absolutely necessary because of the health concerns with coronavirus, and they need to be able to have their voices heard in platforms such as this. And they need to be able to tell the stories themselves and not get it done secondhand from an advocate for them or a service provider, because oftentimes they're not going to tell the story the way it needs to be told. And for me, I always had no problem with, I'm a lot of people that know me would call me a lot of things. Shy isn't one of them. And I have no problem with going and talking to people at the Capitol. I used to go to a conference every year in Washington, D.C., and there were people of all ages, including children, saying, hey, these are the things we need in it. It's never too young. You're never too young to start advocating. If you teach them early, then by the time they get to my age and you're old, like I am, and tired, you can have those kids that come up and can be responsible and be able to have an intelligent conversation about the laws and policies that affect them. And so I would encourage you all that if you come in contact with a child with a healthcare need, give them the space and the knowledge to know what's going on and to speak to them on their levels so that they can also talk for themselves and so that they'll know when policies affect them, what they can do about it, because it's never too early to start. So thank you.
Thank you so much, Cherise. And now Rich Huddleston with Arkansas Advocates for Children and Families.
Thank you, Rebecca. I'm going to use my 5 minutes today to talk about the state budget, which I know is everybody's favorite topic of conversation. I'm going to try and raise a few basic issues I think everybody needs to be on the lookout for this legislative session. As many of you know, the Arkansas state budget has taken some hits over the past year as a result of the COVID pandemic and the slowdown in the economy. Now, our budget has not been hit as bad as it's been hit in some other states because Arkansas had already been budgeting very conservatively prior to the pandemic. So much so, in fact, that I would argue that Arkansas was significantly underfunding critical programs that could improve the well-being of children and families before the pandemic even started. But that's a topic for another session. Arkansas also had some money in some reserve funds and unobligated fund balances that were not being spent that it was able to tap to close budget holes in the shortfall in revenues for the fiscal year that ended last June and for the current fiscal year that will end on June 30th this year. So what's in the governor's proposed budget for next year? He's proposed a net available state general revenue budget of about $5.84 billion. That's a $161 million increase, or 2.8% increase over the current year's budget. Now that sounds like a big increase, but you have to remember that because of the pandemic, the general revenue budget for the current year is actually barely above the state budget that we had in place 2 years ago during fiscal year 19. So the proposed increase is really not as big an increase as you might think compared to prior years. If approved by the legislature, most of the new money in the governor's proposed budget for the next fiscal year would go to K-12 education, Medicaid, and our colleges and universities, all of which are important needs and should be funded. It's important to note, however, that funding for other needs for children and families, like early childhood education, child welfare, and juvenile justice, are basically staying flat and are receiving less than a 1% increase. And there are other important needs, like high quality out of school programs, after school and summer programs through the Positive Youth Development Act of 2011 that have never been funded that need to be funded. The proposed budget that the governor has put forth also includes a plan for spending $227 million out of the $240 million in surplus funds that have been accumulated. His priorities for spending those surplus funds include rural broadband, $30 million, academic facilities, $28 million, and tax cuts of $25 million. But most of the surplus funds would actually be transferred to a long-term reserve fund, about $100 million of that, in a rainy day fund of $25 million. He wants to build up the long-term reserve fund to $420 million over the next 2 years before he leaves office. Now, tax cuts are also included in the governor's proposed budget. It includes a tax cut for used motor vehicles, an income tax cut for new residents moving into the state, and an income tax cut for low and middle income Arkansans. Together, those proposed tax cuts in the governor's budget would cost $36 million next year and $73 million in year two. Now, what the low and middle income tax cut will end up looking like in the legislature is going to be one of the big issues this session. My colleague, Bruno Showers at Arkansas Advocates, will talk more about this at a later Kids Count session this week. But many of us are advocating for a state earned income tax credit, or EITC, that would target desperately needed tax relief to low income working Arkansans who are struggling just to meet basic needs. While other plans being proposed for that low and middle income tax cut would target more of the benefits to upper middle income and some upper income taxpayers. And this is before the legislature even considers other tax cuts for businesses that we know will be coming this session. Another proposed tax cut you should know about is the governor's proposal to cut the top income tax rate for new residents from 5.9% to 4.9%. While this is being promoted as an economic development tool, and doing it for new residents will actually not cost a lot, he wants that tax cut to serve as a starting point for a future bigger tax cut that would cut the top rate to 4.9% for everybody, including the rich, after he leaves office. Now, if that were to happen, it would cost the state budget $276 million annually when fully implemented. It will be interesting to see where that tax cut for new residents goes this session, because if it does go somewhere, then it could set the stage for this much bigger tax cut down the road. And that should concern all of us who care about the state budget and funding for programs serving children and families. Finally, just a couple of notes on budget advocacy this session. If you follow the state budget and budget bills, you should know that even if you see an appropriation bill at a certain level that includes funding for a program that you care about, don't assume that program will automatically be funded just because it's in an appropriation bill that passes. Appropriation is only the authority to spend money if it becomes available. There actually has to be a funding source tied to that appropriation for that program to actually spend money. You should also know that Republicans now have supermajorities that they need to pass budget and appropriation bills on the floor without any support from Democrats. So if there are programs that advocates want to pass in terms of new funding, you are going to have to get support and leadership from Republicans, especially those on the Joint Budget Committee or somebody who's considered a leader on the Republican side. Otherwise, your funding proposal is not going to go anywhere. And then the last point I would make in terms of the session is I think it's going to be really interesting to see what the legislature does in terms of responding to the pandemic. Now, as most of you know, there were several rounds of pandemic-related federal funding that came last year, including one that came at the end of 2020 in December. And there's likely to be one more big stimulus bill coming at some point in the next few months if Congress passes it. But what you need to know about a lot of that federal funding is that it's really going to have to be spent out in the next year or two. So what is the legislature going to do this session in terms of the budget to start addressing the long-term impacts of the pandemic that we know are not going to go away over the next year or two? And I think specifically about those education, those equity gaps in education that have only grown over the past year, according to most experts, for students of color, special education students, English language learners, and others. And so in a few minutes, those are what I see as kind of the big budget issues this session. And thank you for having me.
Thank you, Rich. And finally, Renelle Woods with Whole Youth Services. Renelle?
Just was you need to unmute.
Okay, thank you for this opportunity this afternoon to be able to speak. Rich, that was very enlightening and enriching. Going back to a program that you mentioned that has not been funded since 2011, which was the Youth Positive Developmental Act, which has been a huge opportunity that we did a lot of heavy lifting over the years, being a part of the Arkansas After School Out of Town Coalition. That every year that we bring our case that the legislators have hear it, but then in the change of legislation, we have to go back and start over. But that Youth Positive Developmental Act is crucial, and it was definitely an opportunity to move things forward and have the groundwork laid for an opportunity like this. And there's so many mentioned during this call that so many unknowns moving forward in our state, and we're looking at especially after school and summer learning. We know that an estimate of 61,717 Arkansas children participate in after school programs, and additional over 207,000 would enroll if there were opportunities for them to do so. And hopefully, with the, some type of funding with the Positive Youth Development Act could make this a possibility to go in a lot of different technical areas of our state to be able to provide quality after school and summer learning programs. We also know that in our workforce, we know that parents says, especially during this post-pandemic world that we're living in now, 74% of our parents in Arkansas have said that having their child enrolled in an after school or summer program helps them keep a job. And also it helps them, give them a peace of mind when they're at work. After school and summer learning is very vital. There's been a lot of states that we've done research over the years know that this is a crucial part, and it definitely has to be a crucial part to Arkansas, especially moving forward. We also know why this is important. We're talking about after school programs. Our program has worked digitally and also just across racial barrier lines throughout the years, to making sure that we are reaching those that are on the that are grassroots. There are those that need just encouragement. We've seen a lot of Arkansans and people in the Delta mid-range Arkansas, Northeast Arkansas area that their cars that we took place in the multinational meal distribution, and people are driving, and we see them coming with everything that all their belongings inside their car. It's a tough situation, and I know the psychologist mentioned earlier with ACE that the traumatic effects we haven't seen that will take place in a lot of our children. During this time, we haven't actually even dreamt of what will actually come out and the effects that this has had on our children. But I know, looking at, the long term that we have to look at how we can get quality after school programs all over our state, that we're working together, continue to mold and shape the children in our state. My past experience being in elected official, you have to know that policy and appropriations have to work together. And Rich did a great job saying it. Even though you see the appropriation level, that doesn't mean that it's going to be funded. So, we have to rally together like never before. We are not only in crisis mode, but we got to continue to understand that the time to act is now. Every day is now. This has been a traumatic time for parents and children, and we can make as after school and just educational providers, making sure that quality programs that are accessible to our children and family here in the state of Arkansas, so that as we move forward to some type of sort of normalcy, that our children, which we're knowing that is going to take the RAM at some point, will have the right tools and the right empowerment and enrichment they need to come through this to be a better tomorrow for our future of Arkansas. Thank you.
Thank you to Ranelle and all of our speakers today for sharing that important information and sharing your stories. I know for those just starting off in advocacy, lobbying at the state capitol can be intimidating, but everyone listening today has the power to be a strong advocate for children and improve the lives of kids and families all across the state of Arkansas.